Have you ever woken up in the morning and there is a painful crack at the corner of your lips? You drink some tea and it stings. You smile and it hurts to the point of tears. And for a whole week, you have been smearing it with everything you can, but it does not go away and has even become covered with a crust. Sounds familiar? Then this video is for you, because I will explain why ordinary cracks at the corners of the mouth are not a minor issue at all, but often a signal of problems inside the body. Hello dear friends, you are on the channel of Ksenia Nava. Today we will talk about a topic that few people talk about, but it has surely happened to everyone. These are cracks at the corners of the mouth, and yet, it is enough to understand the causes, and the problem goes away within a week. Today, we will go through all the possible culprits of this condition. I will show how to distinguish a fungal crack from a bacterial one, tell you about the tests that are really needed, and give a clear treatment algorithm. And at the end of the video, I will reveal one medical secret that for some reason almost all doctors keep silent about, although it helps to get rid of cracks once and for all. Today I am presenting a new format of material in the form of an investigation. I am waiting for your feedback in the comments. And if you value honest medical information without fluff and advertising, subscribe to the channel right now, because I have many more such topics, and each of them can really change your health. So, let's immediately agree on the terms. What people commonly call cracks at the corners of the mouth is called angular cheilitis or angular stomatitis in medicine. It is inflammation of the skin and mucous membrane at the corners of the mouth. It looks like a crack, sometimes with a crust, sometimes weeping, often with redness around it. And this is where the most interesting part begins. Most people think, well, the skin cracked, I'll apply some cream, and it will pass. But a crack is not just dryness. It is always an infection, either fungal, bacterial, or mixed. And why it appeared is a more complex question. And it is precisely the answer to it that determines whether your problem will go away in a week or torment you for years. There are actually about 10 causes of angular stomatitis. I will list the most common ones. First, deficiency of B vitamins, especially B2 and B12. They are responsible for the health of mucous membranes. When there are no vitamins, the mucosa becomes loose, easily cracks, and bacteria, or fungi, immediately settle there. The second reason is iron deficiency. Anemia is a common problem in people over 40, especially women. Low hemoglobin leads to poor oxygen supply to tissues, regeneration slows down, and any microinjury turns into a chronic sore. Third, elevated blood sugar is a feast for fungi and bacteria. They multiply at lightning speed. So if cracks appear regularly, and this did not happen before, this is a reason to check fasting glucose and glycated hemoglobin. The fourth reason is decreased immunity. Stress, chronic fatigue, lack of sleep, frequent colds. All this weakens the body's defenses. And then conditionally pathogenic flora, which constantly lives in our mouth, begins to actively multiply. Fifth, improper bite, or dentures. If the teeth are worn down, the bite has changed. Saliva constantly accumulates at the corners of the mouth, and this creates an ideal environment for microbes. The same applies to removable dentures, especially if they are poorly fitted. And finally, the sixth reason, which many people do not even suspect, taking antibiotics, especially long-term. Antibiotics kill not only bad bacteria, but also good ones that restrain the growth of fungi. The result is angular stomatitis that stubbornly does not want to go away. You already understand that simply smearing the crack with cream is like putting out a fire without turning off the gas. You need to find the cause, and for this, let's understand how to distinguish one type of crack from another. If you apply antibacterial ointment to a fungal crack, there will be no benefit, and it may even get worse, and vice versa. Let's start with a fungal crack. It is also called candado because the culprit is the Candida fungus. What does it look like? First, the crack is usually shallow, but can be quite wide. Second, around it you often see a whitish film or coating. If you carefully remove this film with a cotton swab, there will be a bright red eroded surface underneath. Third, a candidal crack is most often weeping, meaning constantly moist. And fourth, it almost never becomes covered with a dense brown crust. A bacterial crack is most often Streptococcus or Staphylococcus. it looks different. The crack is deeper, often covered with a yellowish or brownish crust, which either falls off or builds up again. If you tear off the crust, there may be serous fluid or even a little blood. Around such a crack, the skin is usually red, sometimes even swollen. And here is a characteristic feature. A bacterial crack often hurts more sharply, especially when opening the mouth. Now, attention! There is also a third option, a mixed infection. This is when a fungus settles first, and then bacteria join it, or in such cases, the crack can look different during the day. In the morning with a crust, by evening weeping. Treating such a crack is the most difficult, because combined medications are needed. And here is some practical advice. If angular stomatitis does not go away for more than 2 weeks despite all your efforts, go to a doctor and ask for a smear from the corner of the mouth for flora and sensitivity to antibiotics. This is a simple test, costs very little, and is done in 3 to 5 days, but it gives an exact answer as to who has settled there and how to kill it. By the way, many people ask, is it possible to determine it yourself, somehow? Well, if you have oral thrush, a white coating on the tongue that is difficult to remove, dry mouth, most likely it is also fungal. If you recently had a sore throat, a cold pustules on the skin, a bacterial nature is more likely. But now let's dig deeper and talk about those internal causes that make cracks chronic. We have come to the most important point, because if you remove the symptom but do not remove the cause, the cracks will return again and again. So, what tests are absolutely necessary? The first is a complete blood count with a leukocyte formula. If hemoglobin is below 120 in women and below 130 in men, the cracks will not go away until you replenish iron. The second test is ferritin. This is the body SA iron stores. Even if hemoglobin is normal, ferritin can be at 0, which means iron is just barely sufficient and not enough for normal functioning of the mucous membranes. The optimal ferritin level is at least 70 and preferably around 100. The third test is vitamin B12 in the blood. The laboratory norm is usually from 190 to 900 units. But here is an insight for you. If B12 is below 400, symptoms of deficiency may already appear, including cracks at the corners of the mouth. This is especially relevant for vegetarians and people with gastritis, because vitamin B12 is absorbed only with a healthy stomach. Fourth, fasting glucose and glycated hemoglobin. Glycated hemoglobin is the average sugar level over the past 3 months. If it is above 5.7%, correction is needed. With elevated sugar, cracks will appear constantly, like mushrooms after rain. The fifth test that I recommend, especially if there are other skin problems, is zinc in blood serum. Zinc is critically important for tissue healing. Its deficiency is more common than is usually thought, especially in people who eat little meat or abuse coffee. Caffeine washes out zinc. And lastly, if possible, vitamins B2 and B6. They are tested less often, but they are responsible for the condition of the skin and mucous membranes. B2 deficiency causes cracks at the corners of the mouth. B6 deficiency causes seborrheic dermatitis around the nose and eyebrows, plus the same cracks. Now, imagine that you took these tests, found, for example, low ferritin and sugar at the upper limit of normal, started taking iron and adjusted your diet. A month later, the cracks disappeared and no longer appear. That is the right approach. And if you just apply ointments, you will be applying them for years. I am not joking. By the way, a question for you. Have you ever checked your ferritin? Write in the comments what result you had, if you checked it. I am interested in seeing the statistics among my viewers. And also, write in the comments how you like this new presentation of material. I will take it into account. So, we have dealt with the causes and the tests. Now we move on to the most interesting part, how to treat it. And here I will give you a clear scheme that works in 95% of cases. Step 1. Determine the type of crack. If there is white coating and weeping, most likely it is fungal. If there is a crust and a deep crack, bacteria. Ideally, of course, do a smear, but if there is no possibility, we rely on external signs. Step 2. Local treatment. For fungal cracks, antifungal ointments or creams are needed. The most effective are clotrimazole, pymofuscin, nystatan ointment. Apply a thin layer to clean, dry skin to 2-3 times a day. It is important not to lick or moisten the corners of the mouth, otherwise the treatment is useless. The course is at least 10 to 14 days, even if the crack went away earlier. Otherwise, the fungus will return. For bacterial cracks, antibacterial ointments, such as Levomacult, Tetra, Klein ointment, or Beniacin are used, also 2 to 3 times a day. The course is 7 to 10 days. If the crack is deep and painful, you can make compresses for the first 2 to 3 days. Apply the ointment more thickly, and cover it with a small piece of bandage for half an hour. If the type of crack is unclear or there is suspicion of a mixed infection, we use combined preparations. For example, it contains an antibiotic, an antifungal component, and a hormone to relieve inflammation. But be careful with hormonal ointments, no longer than 5 to 7 days, otherwise the skin will atrophy. Step 3. At the same time, we work with the cause. If anemia is detected, we start taking iron preparations. Divalent iron is better. For example, Sorbifor Duros, or Totema, at night. Wash down with orange juice for better absorption or without it. If there is a deficiency of B vitamins, we add complexes. We take them according to the instructions, usually for 1 to 2 months. You can inject a complex of B vitamins intramuscularly. The effect is faster. If sugar is elevated, we adjust the diet. We remove fast carbohydrates, add fiber, and monitor the glycemic index of foods. If necessary, consultation with an endocrinologist and sugar-lowering medications. Step 4. Hygiene and prevention. Change your toothbrush, because fungi and bacteria may be on the old one. Do not lick your lips in frost and wind. Use hygienic lipstick or lip balm. Make sure that saliva does not accumulate at the corners of the mouth. If you wear dentures, treat them thoroughly with antiseptics. And here is what is important. If cracks do not go away after 2 weeks of proper treatment, this is a reason to be alert. Perhaps it is not just an infection, but a manifestation of a systemic disease. Cracks can occur in blood diseases, oncology, autoimmune processes. Rarely, but it happens. Therefore, a prolonged case is always an indication for a visit to the doctor and an in-depth examination. One more point. Some people try to treat cracks with brilliant green iodine or hydrogen peroxide. Do not do this. These products dry and burn the teeth. Healing only slows down. The only antiseptic that can be used at the initial stage is chlorhexidine, but only for treatment before applying ointment, not as an independent treatment. So, let's summarize. Cracks at the corners of the mouth are not a cosmetic defect, but a signal of problems inside the body. Most often the cause is iron deficiency, B vitamin deficiency, elevated sugar, or reduced immunity. The inflammation itself is caused either by fungi or bacteria, and they need to be treated with different medications. The correct algorithm is this. Determine the type of crack, prescribe local treatment. At the same time, take tests for deficiencies and correct them. Then the crack goes away in 1 to 2 weeks, and does not return. And now the promised secret. Do you know what helps in 80% of chronic cases? Ordinary zinc. Zinc preparations at a dosage of 15 to 25 milligrams per day for a course of 2 to 3 months work wonders. Zinc is needed for the normal functioning of the immune system, for tissue healing, and for suppressing fungal flora. If you have experience treating cracks, if something helped especially well or, on the contrary, did not work, share it in the comments. Your experience can help other people. Like the video if it was useful. Subscribe to the channel so you don't miss new episodes about health and longevity. We have many more interesting topics ahead. And write in the comments how you like this style of presenting the material. Take care of yourself. Be healthy. And remember that prevention is more important than treatment. See you in the next video.